Hello everyone. This presentation is on Sheng Hua Tang, also called generating and transforming decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Sheng Hua Tang is classified under invigorate the blood. A representative pattern is postpartum blood deficiency, cold and blood stasis with abdominal pain and retained lochia. Important ingredients include dangui, chuangshen, tauren, ganjiang, jigan cow. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 33-year-old postpartum woman after hospital evaluation. The current medicines are ibuprofen, enoxaparin prophylaxis, iron. This case gives a plausible reason to consider Sheng Hua Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is dangui/tauren/chuangshen plus enoxaparin. The mechanism is several blood-moving herbs may add to anticoagulant or antiplatelet effects. The clinical significance is potentially high postpartum when hemorrhage risk must be considered carefully. My management plan is do not use without obstetric approval when anticoagulated or actively bleeding. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is ganjiang plus NSAIDs. The mechanism is ginger family constituents may add modest antiplatelet effects to ibuprofen. The clinical significance is low to moderate. My management plan is watch for excessive bleeding or bruising. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is gan-cow plus blood pressure/electrolytes. The mechanism is licorice can cause sodium retention and potassium loss. The clinical significance is usually low in a short course but higher with hypertension or prolonged use. My management plan is avoid prolonged exposure and monitor if risk factors are present. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Sheng Hua Tang may be reasonable when the patient's presentation matches postpartum blood deficiency, cold and blood stasis with abdominal pain, and retained lochia. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.